Hello, guys. How are you going? Good afternoon, Naveen. So, am I audible? Audio video is fine. Good to go. And we had a very, very recent update. Good afternoon, Punya. A very good afternoon to all of you. Good afternoon, Shahrukh. Good afternoon, Shubham. So, I think you must be knowing also there is a circular which is rotating from NMC and it has a big update. Good afternoon, everybody. Yes. So I actually, came live in order to confirm it only that is it true or not? Because I was getting a lot of messages and Acha. No, I'm not rushing to studio today. Um, this is my home only. But I wanted to talk to you people regarding the new update. I think it's a mixed reaction because though it's a update which is postponing the next by 1 year, but at least they are making the things clearer. That is a better option when you do not have any clear cut idea of about a thing, then that is even worse. So at least for something they are coming with a update well in time, not the last minute, and they have told you that next is going to come definitely in 2023. So I think this is well ahead of time, and we are already started, we are already in the process of teaching and learning the things according to the next. So I think DVMCI students need not to panic or worry. We don't require any new strategy because we had been doing it from the last year itself, till from the time there was an update that now NEET is going to be next, so we started that way also. Secondly, fundamentals, concepts, all this is required for your next, so we are teaching in the conceptual manner only, so we don't have to do something extra now. But yes, all the efforts I'll again take so that we can keep it at the maximum pace. Next one, next two, both will be there. And as I always say, practical aspects of the topics is again required. That is the reason I usually try to demonstrate it. Practical things are very much required. And I am from Delhi NCR, and it is best that you cover your wards also. 2017 batch will sit for NEET or next. Now they have not mentioned clearly about this. Good afternoon. So it depends upon when is your internship completing. I have not gone through the complete guidelines till yet. Today I'll sit and see all the parts, and I'm going to read all the brochure, and then maybe in the evening I will be coming up with these doubts also, because again this is also a question which many of the students are asking, that whether 2017 batch will go for NEET and next. Now, when it was in 22, then it was definitely next. But if 2017 people are going to give the examination in 22, I think they will be giving the NEET only. 99% of the according to me, it will be NEET only next year, because next will be 23. Why of TAL is given importance of 60 MCQs in the next? So you have to ask them, I think, why they are giving the importance. They are not just giving importance to Ophthalm, it's all the clinical subjects of Ophthalm, ENT and pediatrics. All three will be having 60 questions each. And medicine, surgery and gynae, they will be 120 questions each. It will be a 3-day paper. And I think this is justified, because you are not reading ophthalm for rest of the year if you are not doing the residency in ophthalmology. And that little knowledge is sometimes dangerous. You people are prescribing the steroids to anybody. And explain about next. Next is actually the transformation of the NEET PG examination. And previously we were having the 300 questions in the NEET PG, which was having the three sections: the section A, B and C. Section A consists of your basically the preclinical, anatomy, physiology and the biochemistry. Then section B, this was just 50 questions, 50 marks. And then the next was your 100 marks, that was your paraclinical. And the section number C was the maximum marks, that is your 150 marks. That is basically consisting of the clinical questions. That was the last year tak. Now this year they are saying that they have reduced the number of questions, and it will be just 200 questions. Now what is actually predicted about the next? They have already told that next examination, earlier it was predicted in 22, now they are saying it will take place in 23. And that will be your 3-day affair. First day it will be medicine in the pre-lunch session, 3 hours, and post-lunch session will be your ENT. Then second day it will be surgery along with the pediatrics, and third day it will be obs and gynae along with the ophthalmology. So number of questions they have increased, 120 plus 60 each day, 540 questions. This is the whole story about the NEET PG and the next. So for 60 questions, high weightage, should we read Khurana or Parsons? Read both. You have to read both. Parsons series I will definitely continue. Don't worry about that. I was busy in classes, that's why I could not continue. So I'll be continuing with the Parsons series. That is again very very important. 60 questions integrated or pure ophthalm. See, 60 questions that will be coming from ophthalm, we do not know what type of questions they will give, but they will be from ophthalmology. We are yet to have one paper of next. We do not have any sample there. We do not know what they are going to do. But the thing is that they will be clinical questions, large questions. They will not be one liner questions. And because there are 60 questions, so they will be covering every part of ophthalmology. So when they are covering every part of ophthalmology, they will be asking you the integration also. So I think it would be every type of question. Yes. So this was in brief about the next. It was important update, and all those people who are there from 2017, 18, 19. Now be prepared. You are going to have the next, and as and when I'll get more updates also, you will be getting it from my site. In next two, ophthalmoscope use will be asked in ophthalmology practicals. Yes, in next two may they have not defined that what kind of paper they will give you, whether it's a subjective paper or it's a objective paper. But yes, it's a practical paper. So at least those basic procedures that we are doing in ophthalmology, OPD, they'll be asking about that. So you should know about the practical aspects of the tonometry, of thermoscope, slit lamp, the fluorescein test, the cobalt blue filter, the parts of thermoscope. I think these are the basic things. Then Parson series are a savior. Yes, I think so. I think when I started with the Parson series, that was a luxury, a extra edge. But now, as and when we are going towards the next, that will become a basic thing and a necessity of the hour. I want all of you to read the Parsons not as a choice. Don't choose between Qurana and Parsons. You have to go with both. Now, if you have already read my notes, most of the Qurana you will find incorporated, so just give a reading of Qurana. You will be done with the Qurana. Parsons ki all the high points are also added. Then if you want to read line by line Parsons, you are most welcome for the Parsons series. ठीक है ना? Yes. Should we know to see fundus? No, it's not expected of you people. Like if you are seeing fundus at your UG level, what will you do at PG level? You will not be expected to see the fundus, but you will be expected to know what are the things one can see on the fundus, what are the different procedures by which I can see. Where do you see the optic disc, what is the dimension, is it nasal or is it temporal? So those things you need to know, not how to see. Next three तो है ही नहीं, next one and next two है. Next one is totally your this objective paper, which will be your similar to the NEET PG, and next two will be a practical paper. So just fail and pass is required for that. Hello, Rahul. So this was Parson series is superb. Thank you so much. Thank you. So I will try to continue with the Parson series. Just give me some days, because you know some of my data just came from the college. Yeah. Actually some of the data is lost because my laptop was not fine. That is why I am trying to restore the things, and then again I'll come with the Parson series. That is not a problem. OT procedures, again OT procedures में वही पूछा जाएगा which is at your level. They will not ask you to perform a surgery. Basic steps of Calazion है, destructive procedures हैं, cataract surgeries हैं, only those things will be asked. So it is expected that only those things which are under your scope, only those things will be asked, not the higher level. Pre and paraclinical subjects will not be asked directly now. It will be a clinical anatomy, clinical physiology, clinical biochemistry, pathology hai, pharma hai. All this will be asked in the integrated questions of the medicine. So when that is why they are giving you 120 questions of medicine. It will be pure medicine also. Then medicine mein hi the pathology part hai, then the pharma part, the derma, the psychiatry, and the radiology, that all will be included in the medicine only. Similarly if you come to the surgery, so surgery may the anesthesia part, that is also asked here. The radiology of the surgical topics, that will also be covered in this only. So it is something like this. So इसीलिए 120 questions are being given for this. So you will not be asked the core anatomy now, not the core physiology, not the core biochemistry. It will be asked in a form of clinical scenario, the integrated fashion. That does not mean that you do not require the knowledge of anatomy, physiology, biochemistry, because these are the basic things. If you do not have this knowledge, it will become very difficult for you to understand the medicine and surgery. But the questions will be asked in the clinical scenario form, not the direct one. No histopathological pictures in the questions now on. Why not? There will be histopathological pictures in the medicine questions. They will be asking you now. So they can ask you the histopathological pictures, but not as a direct patho question, but as a clinical scenario one. Yes. So what will happen exactly to 2017? अभी देखना पड़ेगा. I think अब तो they have to give the NEET only till the time they have new plans. अभी उन्होंने 2017 next year का they haven't mentioned. They have just said that कि to next exam is postponed for a year due to the pandemic times and all, and they require time for creating everything. So because this year till now we do not have the NEET PG date. So obviously we were expecting this, that how can next take place in 22, so they require time. So next will be in 23. That is the information. Can we go pre-para superficially? I don't think so. It will not be a good idea, because if you are going superficially, then again solving the questions of medicine will become difficult for you people. Microbiology part hai, pathology part hai, all this will be required in solving the question. So I think don't go just superficially. You have to cover all these subjects. Yes, the way of asking the questions is definitely different. It's going to be different, but it's not that they will not be asking this. Still, these questions will be asked. Yes. So I think this is all for this session. This I kept a small session so that I can tell you, I can converse with you about the next. And yes, definitely I'm coming with the more updates. I'll try to see uh, in 23 which exam we will give, the practical or the MCQ part. See, if you are in 2017 batch, 2017 batch, then you are going to give paper next year. Then it is same NEET PG up to the current information. If you are giving the paper in 23, then it will be on next only. You have to give both next one and next two. Background of your house is so beautiful and lively. Yeah, वो green background तो actually I have kept for different purposes, for the studio purpose, and every time I cannot remove this, so that is why I also felt boring. That is why I have come up here to take the live. Hello Jigyasu. Oftal quiz on YouTube. Oftal quiz YouTube पे कैसे होगी? YouTube लाइव में, देन यू पीपल हैव टू कमेंट ऑन द कमेंट सेक्शन. फिर कैसे करोगे? किसी का नेटवर्क चला जाएगा. हाउ विल आई बी कंडक्ट द क्विज ऑन यूट्यूब? लेट मी सी अगर कोई ऑप्शन है. इफ यू नो समथिंग देन लेट मी नो, आई विल वर्क ऑन इट. यस, आज दोपहर में, क्योंकि अपडेट आया था तो बहुत सारे, पूरा मैसेंजर मेरा फुल है, टेलीग्राम आस्किंग अबाउट दिस अपडेट. तो मैंने सोचा कि व्हाई नॉट कमिंग लाइव एंड आंसर टू ऑल. तो बेस्ट वही टेलीग्राम है, बिकॉज दैट एक्चुअली ऐप इज अकॉर्डिंग इन अकॉर्डेंस टू द क्विज. तो वो क्विज गोज बेस्ट ऑन टेलीग्राम. बाकी अगर देखते हैं, इफ एनीथिंग आई गेट एनी वे हाउ आई कैन कंडक्ट, देन आई विल डेफिनेटली सी फॉर यू. सो थैंक यू सो मच गाइस. ठीक है, आई विल वीडियो फॉर थर्ड प्रॉफ ऑफ टेल. ठीक है, आई विल डेफिनेटली ट्राई टू डू सो. बाकी प्रॉफ वाइज स्ट्रेटेजी वीडियो आई हैव ऑलरेडी शेयर्ड. एंड ठीक है, 2017 बैच के बारे में आई ट्राई टू सर्च मोर ऑफ द डेटा एंड देन आई कम टू द फाइनल कंक्लूजन. मेनी पीपल आर वेटिंग फॉर दैट अपडेट. Let me see, and then again in the evening I'll update you more about the information that I am getting. ठीक है. हाँ, Morris, OS and OD. OD मतलब right eye, OS मतलब left eye. This is the term that we are using in the OPD prescriptions also when you look at the old times. OD matlab right eye and OS means left eye. So that is there. So guys, take care, and we will be having the updates, and I'll conduct the quiz live also today for the explanations. Yesterday I got very late. I could not do that. So today I will be conducting that quiz explanations live also. Okay? Take care. Bye-bye.